Malawi's High Court has temporarily prevented the government from introducing a 3-week lockdown to curb the spread of the coronavirus. It follows a petition from a human rights group. Now, the Human Rights Defenders Coalition argued the authorities had failed to announce any measures to help the poor during the lockdown to start on Saturday. Market traders, sex workers and others in the informal sector have held violent protests across the country. They say the lockdown will force them to go hungry. Now, we've asked Daniel Mababa, a Malawian journalist, to join us via Skype for the latest from that country. Dan, a very good evening to you. Thanks for joining us. Welcome.
Thanks for having me tonight.
Now, good stuff. Now that the court has granted the coalition an injunction, which essentially means that there will be no lockdown for the next 7 days, what will happen after the 7 days?
So at the end of the 7 days, there will be an inter-parties hearing between representatives of the Human Rights Defenders Coalition and lawyers for the government. They will meet in a judge's chamber to deliberate. I know exactly what the HRDC is bringing to court. They want a clear, spelled-out plan from the government that will stipulate how the poor of the poorest, the vulnerable, the informal sector, how they are going to survive the 21 days. Because most of them are saying we live on hand to mouth, and therefore locking us down for 21 days is a complete joke. We know the government will go to court to defend what it is calling acting to save lives. Government has maintained it is doing all this in the interest of the people to save lives. So those will be the matters under discussion in a judge's chamber after the 7 days.
And having said that, Daniel, did the Human Rights Defenders Coalition offer any alternatives, any tangible alternatives to a lockdown that seek to curb the spread of this virus?
So, but clearly, they are claiming that they are not against a lockdown, but that they want those measures, like I've said, spelled out in black and white. They have not clearly indicated what they would like to see, but government has suggested, among other things, a provision of cash to people, and also to allow some traders, some smaller markets to continue to operate between specific hours during day. So clearly, nothing special, nothing out of this world from the Rights Defenders Coalition, but they want assurances from the government that whatever is promising in terms of cash, in terms of the social cash transfer in particular, is working.
So, but then does the government have the capacity to meet those demands in terms of offering cash and food?
Very difficult to say. Government continues to beg for foreign assistance, people of goodwill. We know there is that cash inflow coming in. We know the Reserve Bank is in charge of that. Government has not come out in the open yet to articulate or to say how much it has received, but it continues to beg. I mean, talking of the social cash transfer, it's a program that's been running, but it's not as effective. It's marred with fraud, maladministration, and therefore it may be rendered not so effective to assist the people using that window of program, the social cash transfer. Just yesterday, we heard from the government spokesperson, Mark Botomani, speaking to the international media, where he claimed government is putting together a special fund to provide grants to members of the informal sector. We are yet to see how that pans out because the demographics are not clear. I don't think government has the numbers of the particular people that need that help, the particular people that must be targeted. We don't have statistics. And so how that works out in terms of providing grants to the informal sector is something that remains to be seen, but it's a huge challenge, it's a huge task for the government.
It is a big problem. It is another problem, the fact that the government does not have the statistics, so that they have an idea of how much work they need to put into fighting COVID-19. And with a population of 18 million plus people, the country, I would say, is sitting on a time bomb because they have little testing capacity. Most people have got scant access to modern healthcare, and therefore the risk of the outbreak is high.
Precisely. You see, we only have 4 testing centers against a population of somewhere around 18, 19 million. The last time we spoke, we were speaking about the issue of ventilators. As we speak now, of course, there are positive trends, positive figures, latest figures that we've been getting as of Friday, to the effect that 3 of our 16 cases, there are 17 now, 1 confirmed yesterday. 3 of those have tested negative after tests on Thursday. They will undergo another test. It was scheduled for today. The results aren't out yet. Very positive strides there. But still, I will put again to you that the threat remains so high because of very few testing centers, inadequate equipment in isolation centers, and all those challenges, particularly also the fact that this lockdown that was to commence this midnight, but like you've said, it's been stopped, was going to take place with some very loose conditions, if I may say. Smaller markets were still going to operate. People were still going to be allowed to go to their fields and harvest, things like those. So it's a chicken-egg situation, a very difficult time to try and maintain livelihood, at the same time try and contain the spread of the pandemic. I was just watching your minister there, who claims the virus is spreading because people are not staying in their homes. And basically that's the challenge across Africa, across the world, with this pandemic. Malawi cannot afford to have her population locked inside their homes. This is a population that lives, a majority of it, living on less than $1 in a day. That's a hand-to-mouth economy. So, very difficult time. And
I'm actually glad that you raised that issue, Daniel, because there are concerns raised by the protesters. We've seen them brandishing, banners with the slogans such as lockdowns are more poisonous than corona. These concerns, I must say, are very valid. And with regards to how they will be affected by the stagnation of the country's economy. But these are also concerns that have been raised by all the countries on the continent. And all these countries have also instituted and implemented lockdowns, bearing in mind and being mindful of the fact that it could, in the long term, lead to the stagnation of the economy. But they still went on and implemented those lockdowns. So what would make Malawi then isolate itself from the rest of the African continent with regards to curbing coronavirus?
Sure, that's a $1 million question. But look, the government says it understands the concerns from the people, and I would not sit here and say they are not justified. No, I'll be lying. They are justified, and actually, economic experts fear that a lockdown would actually kill more people, like you rightly put it, would actually kill more people than COVID-19 itself. But then I would also understand the position government is in, to try and contain, because the economy may only rebound with its population healthy, with the pandemic wiped out. I think that's the only healthy situation. So like I say, it's a chicken-egg situation where you are saying within the 21 days, how will our families survive? That's the business community, the informal sector on one hand, and government on the other hand is saying the economy is already grounding to a halt with the pandemic. Our borders closed. We are a landlocked economy. Our borders are closed, no flights. It's complete stagnation. the economy is at a halt. The best thing to do, let's contain it, or let's deal with it once and for all, and then get the economy back on the wheels again. But the people don't seem to understand that. So it's a question of trying to communicate while the government is trying to put in place those safety nets to cushion the people in this very difficult time. The government is racing against time. Because like I put it, the economy is almost grounding to a halt now.
Has the issue of the personal protective equipment, especially for health workers, been addressed?
The health minister, who is also chairing the cabinet committee on COVID-19, indicated that that would be done by Friday. That's yesterday. I haven't been able to check if that is the case, but as of tonight, I was checking one of the biggest referral hospital in southern region. That's the Queen Elizabeth Central Hospital. As of tonight, there are no supporting staff, no nurses working there. Some wards are deserted. So their demands are, they're demanding a lot of stuff, a couple of things I should say.
When you say these hospitals are deserted, does that mean that the doctors and nurses have stayed away?
The nurses and doctors are staying away. And for the case of Queen Elizabeth Central Hospital, from what I've been hearing tonight, some patients had to be discharged, or maybe they had to leave. Someone said they had to be discharged, or maybe they saw there was no help and they just had to leave. So that issue, yes, it has been addressed in a number of areas because there were widespread or sporadic protests by health workers, particularly nurses and midwives. That has been resolved. So it could be just a few cases where, or a few hospitals where that remains a problem. But apart from the personal protective equipment, there is an issue of their allowance.
So in those hospitals that are still operating, Daniel, just apologies for interrupting there. For those hospitals that are still in operation, is there any provision for these personal protective equipment?
Yes, in those hospitals, there is that provision, because I will report here that the equipment or the protective equipment is available from what we are hearing from government. We got supplies from China and elsewhere. The minister earlier said they had logistical hiccups to get the supplies to the district hospitals. And as of Friday, like I said, he had assured the nation that the supplies will reach almost all the remaining district hospitals. So those that are working, yes, they have the protective equipment.
Daniel Mababa, Malawian journalist joining us via Skype. Thank you so much for your update and for your time. Much appreciated.